I'm going to speak today about osteoarchaeology and our findings from looking at the human remains that were recovered from Killaclohane. But to give you some background as to what osteoarchaeology actually is, I'm going to run through what we do, what we actually find out when we look at human skeletal remains. Just to give you background before we talk about the cremated remains that were recovered from Killaclohane. An osteoarchaeologist is an archaeologist who is trained in the analysis of human remains. So when we get human remains from archaeological sites, we're looking at them not only to find out about the life of that person in particular, but also to find out what information we can get about the society in which they lived and what it's telling us in broader terms about our history and prehistory. When we're looking at the human skeleton, one of the things that affects how your skeleton develops most and how susceptible you are to actually, things like diseases is nutrition. And if somebody's well nourished from the womb, basically right through to when the skeleton stops developing, which is essentially in your 20s, but it will be in your late teens really, it will show on the skeleton if you're well nourished and it will impact on your life. Whereas in contrast, if you're undernourished or malnourished, that will significantly impact, first of all, how the skeleton grows and develops and how you'll end up as an adult if you survive. And secondly, it will impact on the teeth, in that the teeth will show evidence of stresses to diet and stuff in childhood. Nutrition is particularly linked with disease. If somebody is undernourished, then they are more at risk of developing particularly infectious diseases. They're more at risk because the immune system may be run down. And for much of human history, it's very much a cyclical thing of if a population experiences food stresses, then diseases become rife, and it's a vicious circle essentially. The other thing that impacts how your skeleton will look is work practices and what work somebody may be engaged in. If you're involved in heavy, strenuous work, where muscle mass will develop in particular, then the skeleton will reflect that, where the muscles attach onto the bone will be much more robust. If somebody's involved in an occupation where, for example, they're using their hands more, like in weaving, then the bones of the hands may become more arthritic more quickly than somebody else that's not involved in that occupation. And the other thing that we have to consider all the time is the ability of humans to adapt to circumstances. An individual person will adapt to whatever kind of life throws at them to a certain degree. Obviously some things are beyond your control, but populations in general, and particularly groups within certain socioeconomic levels, for example, the very, very poor or the wealthy, their skeletons will reflect their circumstances. The image in the bottom right is to show how humans have adapted to their environments over time. So the three gentlemen on the left-hand side are adapted to where they live, what they experience, whereas the guy on the right-hand side is adapted to where he comes from. And we take all of these factors into account when we're looking at skeletons as to why the skeleton actually looks the way it does. Finally then, the other thing that we look at in osteoarchaeology is how somebody is actually buried and how the dead are treated after death. How is the body processed, and how are the living benefiting from certain treatments of the dead? And what we always say is that the dead don't bury themselves. It is the living that bury the dead, and it is the living that impose certain, I suppose, ideas on what benefit certain burials will be to the wider community. When we recover human skeletons, and I'm speaking first about skeletons because that's what we come across probably more often than cremated bone. But when we come across human skeletons on site, like everything in archaeology, it is a very scientific, methodical, slow and detailed process of excavating and recording. We only get one chance to record the skeletal remains on site, and once we have lifted those remains, we take them to the lab and do further analysis, but we only get one chance to record that burial in the field, and that's the crucial first step. You can see from this photograph how important it is to have a very rigid set of standards in place to record burials in situ. And similarly with this one, these are the remains of almost 50 individuals who were executed and the bodies were dumped. But you can see the technical challenges even in excavating something like this, not alone recording it before you're even considering taking it to lab. When we get a human skeleton, there's a certain list of things that we go through to analyse every single skeleton. And so, just very quickly, these are establishing whether, particularly fragments of bone, whether they're human or animal in origin. The minimum number of individuals, maybe particularly in prehistoric tombs, where instead of getting skeletons, you might be getting bundles of bones and trying to figure out how many individuals are represented. The age of death, how old somebody was when they died. The younger a person is, right down to fetal bones, the younger you are, the more accurately we can determine the age of death. By the time you get to about 45 years of age, we can't tell just by looking at the bones how old somebody was. The sex of the individual, and this is biological sex, this is not about gender. Female individuals will generally, the skeleton will be adapted for birth, whereas male individuals will tend to be larger and more robust because they have larger muscle mass. The stature, how tall somebody was when they died, and we can estimate that from the long bones, and that's linked back again to nutrition and how their childhood has panned out, basically. Dental analysis is telling us about their diet especially, and also about some stresses that they might have had in childhood, but we can tell if they've had a lot of carbohydrates or sugars in the diet. There are other methods, scientific methods, looking at isotopic analysis, where we can get very, very detailed information about diet. For example, where somebody was born, where they may have moved around, and ultimately if they, like Michael was saying earlier, if they're from the area where they're actually buried or not. But this again is what I'm talking about here, is just looking at the bones. And then finally, the evidence of disease. What evidence of disease have we from skeletal remains? This is just standard issue photographs of what a lab might look like, some of the instruments we might use, and the storage facility when human remains are excavated. I'm going to run through quickly some photographs just to show you some of the information that we can get from looking at skeletal remains. These two teeth here have dental cavities, which is basically rotting teeth, and they've also lost probably 2 teeth prior to death, and that's very common in skeletons of a certain age. But what I'm pointing out here in particular is these two, the oval lesions that are evident in the teeth here. When we find these on skeletal remains from sites, we can tell immediately that these are what's called post-medieval in date, so that they're at least probably 18th century and 19th century, because it's evidence of clay pipe smoking. And we know that clay pipes only became gradually more common as tobacco became cheaper once the Americas were rediscovered. This is an example from Dominic Street in Tralee. It's a dramatic photograph. I like the photograph because you can see the skeleton there, and the 3 posts that appear to be driven down through the skeleton. They have nothing to do with the burial. It's a much, much later event, and that's what part of the archaeological process is, establishing the sequence of events on a site. When this was excavated, we discovered that he was basically hacked to death with a sword and probably an axe as well. Some of the remains of this individual are actually on exhibition in the Kerry Museum at the moment. It's well worth having a look at it just to see what the actual weapon injuries look like when you see them. This isn't that same individual, but it's showing what a sword cut would look like to the head, where the black arrows are showing the edge of the blade itself, where the blade is cut into the bone, and the white arrows are showing where the bone has literally shattered from the impact of the weapon. And this is the jaw of the same individual, where the front of the jaw has been cut through with an axe or a sword, and the entire jaw has literally shattered in half. You come across sharp force trauma quite often in archaeological remains. The other thing we come across, I said, infections have killed more people in human history than anything else. We had no, antibiotics were only a very, very recent invention and still can't cure everything. But you could literally die from the simplest injury for most of humankind. This is showing the bones from a female adolescent from a workhouse, and you can see the top one here is very, very thick, and there's this, it's a drainage hole here, and there's another one, and there's a few others on the other side. These are actually the left and right of the exact same bone of the fibula that runs down the side of your shin bone in the lower part of the legs. And it's a condition known as osteomyelitis. It's an infection of the bone marrow. We don't know what caused this in this teenager girl, but she did have rotting teeth. She did have dental abscesses. And without antibiotics, without modern medicine, something like that can spread through the bloodstream and could cause something like this. The lower left leg in her would have been severely swollen and would have been really, really hot to the touch, and would literally have been draining out infected pus and dead bone fragments out through the surface of the skin. But she didn't die from this. This wasn't even active at the time of death. She had it for years, but it wasn't active at the time of death, and it wasn't what killed her. And you get some inclination of what humankind have put up with in terms of disease over time. This is another example from a workhouse of a burial. You can see when it's highlighted the spine, the twist on the spine, and this is showing where the breastbone is in relation to the pelvis. So if you imagine your own body, how the constriction that would occur. It's scoliosis, it's where the spine is curving to the left and the right. And without modern medical intervention, the entire abdomen will constrict. It'll literally squash down on itself and places massive stress on the heart and the lungs and all the major organs. And I think eventually you can literally drown, your lungs will drown. The skeleton from the workhouse, that male, he hadn't used his lower limbs in years. He was essentially immobile because there was no muscle mass at all in his legs. And he, lived out his last days inside a 19th century workhouse. These are occupational markers. It's showing, the red is showing the back of your shoulder blade. And sometimes the very tip of it, you can see it in the black and white photograph there on the top, on the left hand side, where this triangle of bone will be unfused to the rest of the scapula or the shoulder blade. This condition was noted in a lot of skeletons that were recovered from the Mary Rose, King Henry VIII's flagship. And when they were able to analyse where on the ship the skeletons were actually recovered from and who would have been on the ship at the time, the investigators linked it with them being archers and being trained in the art of archery from a very young age, because having that little tip of bone unfused on your shoulder blade actually allows somebody to draw their arm further back. So if you imagine drawing the bow and arrow, that would give them that adaptability. And so it's, again, evidence of adaptation. This is just a nice photograph showing teeth with very unusual markings that you can see from a man from medieval Kent. And again, it was suggested with this that it's somebody holding iron nails in the teeth consistently over time, and that's the impact it can have. We also get evidence of, the dead and how they're treated, particularly in the 19th century, and we get evidence of autopsies and dissections, but that would very much be a 19th century kind of finding. And then in terms of osteoarchaeology, what we would get called out relatively often are scenes where human remains have been uncovered and there's a question as to whether they're archaeological or of modern forensic interest. We established quite quickly that they were archaeological remains. They're just some of the scatters of bone that were recovered, or that were visible, and it turned out to be the burial of two children next to each other. And there were other burials in the area as well. But on excavation, it became apparent that there were insect remains with the skeletons. And there was larvae cases and evidence of wings and legs of insects. When the insect specialist looked at them, she found that they were the remains of blue bottles, and coffin flies, evidence of decaying bodies. The local information on the site said that it was from Great Famine burial ground, which linked in quite well with, these were decomposing bodies, buried quickly. But when we got the remains radiocarbon dated, the skeletons were actually over 1,000 years older than that. They were early medieval in date. So it's quite spectacular survival of insect remains in particular in this case. And then finally, over recent years, I suppose there's been more use of osteoarchaeologists in the investigations of crypts, underground burial grounds dating to the 18th century, but 19th century probably in particular, and into the 20th century. And it's where, the burial vaults are still in use and they want to put in more burials, but they need to clear some of the older remains. And osteoarchaeologists are recognised as being probably, best placed to assist in that in the most respectful way. I'm going to move on to cremation rather quickly, because that is the condition of the remains of the human remains that were recovered from Killaclohane. So in those definitions, you can see cremation is reducing a body to ash. It's burning away all the flesh so that all you have remain is ashes. In modern cremations, the body is put into a wooden or probably a cardboard, some combustible type of material into an oven where gas jets ignite. they burn the box, and then the body ignites. And it's once the fat in the body ignites that the body starts cremating. So essentially the body cremates itself and you end up with your ashes. In modern times, people do various things with the ashes. They can be put into urns, and the urn may be kept in the house, or it may be put into what's called columbaria, which are, you know, you can see them there in the bottom left is a Roman one, the bottom right is Victorian, the top one is a modern Parisian cemetery where the urns are kept. Other people choose to deposit the ashes, for example, at sea. There's instances of where ashes have been made into jewellery. The ashes have been incorporated into paint for paintings, and ash has been incorporated into tattoo ink as well. So, you know, it certainly seems to attract possibly more unusual practices that, in modern times at least, than, you know, your standard burial. The problem with those definitions of cremations is the reducing of the body to ashes, because cremation doesn't reduce the body to ashes. It actually results in fragments of bone like you see here. And the only reason you get ashes from a modern cremation is because they're deliberately ground down. They're literally put into a machine that grinds them down into ash. This is what you can actually end up with big fragments of bone that are clearly identifiable. But nobody, I don't think many people nowadays would want an urn back full of this from a modern cremation. So this is what we come across in archaeology. In archaeological context, in Ireland anyway, cremation is especially a prehistoric method of dealing with the dead. 71% of the human remains in Irish prehistoric contexts are cremated. And when we look at the prehistoric period, they're especially a Bronze Age, it's particularly a Bronze Age rite. The way we can come across them is in kist burials, which are pits that are lined with stone slabs and covered, and sometimes they'll have pottery in with them. You can also get more commonly the pit burials, which are literally just a pit that's dug and has cremated bone deposited in it. And sometimes you'll get entire, literally, cemeteries of these pit burials. And then these are just some of the very fancy urns up in the National Museum that cremated bone have been recovered in. Nepal, I suppose in particular, is one area that, you know, universally still practices cremation. And it's when you see the cremations here, it's a reminder of what is going on before a body is ever cremated, and of the complexities that can be involved that we can never ever actually identify in archaeology. Before somebody is cremated in these sites in Nepal, the body can be dipped in the water. The body, it'll be undressed and redressed, and then there'll be all these rituals of, you know, offerings of milk. You can actually see the milk pouring down the steps into the river. But there's a lot of complex things going on in the background that we will never see in archaeology. And, you know, you don't get this obviously in modern Western cremations, but it's an idea of some of the things that can be going on in the background. When we are looking, the analysis of cremations differs from when we're looking at skeletons, because we're obviously limited because the bones are fragmented and burnt. But what we would look at in particular is identifying if there's animal bone in it, because very often you will get animal bone in human cremations. How many individuals are represented by a sample of cremated bone? The weight of the sample, what identifiable fragments there are, and what weight are those fragments. And then you look at the colour of the fragments and the condition of them and the sizes. And it'll become apparent why we're separating out things like this. So the concentration when you're looking at cremations isn't on, you know, looking at age and sex, because usually you can't actually determine that. It's looking at a lot about the cremation itself. When we're talking about Killaclohane, as we said, cremation is the only process of treatment of the dead that we've seen over there. These are some of the cremated bones from Killaclohane. These are again on exhibit in the museum across the road. You can see that's just a bundle of bone on the left, but down here, just to give you an indication, these are the roots of teeth, and in the top these are tooth enamel. The roots will generally stay complete because they're embedded in the jaw, so they won't be as affected by the fire. But the tooth enamel will typically just shatter, completely shatter, unless you're talking about juveniles where the teeth aren't erupted yet and they're still protected. When we looked at this and looking at the fragments of bone, literally just by looking at them, all we could establish in terms of the minimum number was that there was one adult individual. We know from DNA that there was a female individual in the sample. So that's literally the limit in terms of that information. When we're looking at the skeleton weights, the skeleton of a female adult, because that's the information that we have in terms of all the remains that from Killaclohane, weighs 2.8 kilograms. This is the equivalent. It's 52.8 Dairy Milk chocolate bars. That's to give you some idea of the weight of the skeleton of a female adult. The weight of cremated bone is different because there's obviously no flesh. They're completely dried. They're dehydrated. So the bone can weigh anywhere between 1.6 kilos and 3.5 kilograms. The total weight of bone recovered from Killaclohane was just 121.2 grams. So that's that equivalent. If you're talking about just a single female adult individual, you can see this is no means representative of the complete remains of that female adult. And just remember that kind of weight and how low it is. When we look at the fragments that were actually identifiable, this is it broken down. Michael showed you a plan earlier of Killaclohane as it was excavated, and the yellow markings showing where the cremated bone was recovered, and basically they're called individual contexts of bone. So these are some of them divided out. When we looked at those particular concentrations of bone, it became obvious that at least one comprised only bones of the skull, and two of them comprised only bones of the limbs. And this suggests that, at least in some regards, there's a selective process going on. If you cremate somebody in a pyre and you don't go in with rakes, trying to get the fire to burn higher or anything, if you literally just let it burn, the cremated remains will retain the outline of the body. So you could literally go in afterwards and the cremated bones of the skull will be where the head of that individual was. So you could literally pick out fragments of bone. And that's what seems to have occurred, at least perhaps in certain parts of Killaclohane, that they've selectively chosen pieces to be chosen first and then deposited them within the tomb. There is a lack of bones of the torso that you might notice, but it's actually very common in archaeological cremations, probably because the bones are actually very fragile in the torso. The fragment size, we literally passed the entire sample of bone through sieves to see the sample size, and this can tell us whether bone has been processed, because in a lot of archaeological cremations there will be evidence that the bone has been, after cremation, has been pounded down to be very, very small fragments. This isn't Killaclohane, this is another site, but it is giving an indication of these two in particular, where most of the fragments were less than 10 millimeters in size, and 10 millimeters is kind of the cut-off. If more than half the sample is bigger than that size, then we would suggest it hasn't been processed. But unfortunately in Killaclohane, the sample size, that 121.2 grams, is just too small to be certain of whether anything like that went on. The bone colour, again, it's to do with the temperatures attained to complete the cremation, to literally completely obliterate all flesh and to turn the bone white. And the temperatures that would be needed are between 645 and 1200 degrees Celsius. With Killaclohane, most of the fragments were white, but there was a few that had blackened surfaces. Most of a very, very limited amount, but those fragments were from the insides of long bones, which would be the last pieces of bone to shatter and be exposed to fire. And similarly, some skull fragments, the insides of the skull were slightly blue, which would be, they might be the last to be exposed to the fire again. What we did get as well is 3 fragments of bone, and I know it doesn't show up very well there, but there was a very, very faint green coloration to parts of those fragments of bone. And you'll see it more clearly in this. This isn't a fragment from Killaclohane, but hopefully you should be able to see there's almost a triangle that's visible there of a blue-green stain. And when we come across this again, relatively often, to be honest, in some archaeological cremations, and it's evidence of metal being, with the body during cremation. We already know that the tomb was used in the Neolithic period, but also in the Bronze Age. So this is presumably evidence of the Bronze Age burials at least. And then this is a very important factor, because if you think back to what I was saying earlier about the evidence of one individual being in those burials, despite the fact that we know, the tomb was used for a long time. When we look at the fracture patterns of the fragments of bone, we see there's concentric fractures, which are like U-shaped fractures in the bone, and then some of the fractures have very straight edges. And these are generally taken of evidence of how, or the condition of somebody when they were being cremated. If a fleshed body is cremated, the concentric fractures can occur, particularly it's in the limb bones basically, when the flesh is constricting as it's burning. And it's the pressures that puts on the bone. It's literally pulling the bone apart, and it results in those U-shaped fractures. The straight fractures tend to only occur in bone that has been defleshed and that has been added to a pyre, that has been added to a fire, and it just shatters. It doesn't have that flesh constricting, putting those forces on it. And this is essentially evidence of multiple individuals, not surprisingly, being deposited in the tomb. They may be contemporary. It may be a case of they're burning a fresh body and putting defleshed remains on that cremation, or they may be entirely separate by thousands of years. We don't know. But it's picking out those little nuanced pieces of information to say that there is more evidence of individuals being buried there. And finally, this is a very worn, smoothened edge, and in comparison to kind of more jagged edges of the other two fragments. And this type of thing has been identified in other cremations as well, in larger deposits of bone. But in these two examples, you can see in the black and white one, there's a very smoothened fragment of bone in the bottom half, and then the other coloured photograph, there's actually a white, pure white fragment of bone. And these may be an indication of, a piece of bone from an older cremation being added to a more recent cremation. It's a continuation kind of a process, presumably some type of ancestral and continuation. And it's interesting, to see this as well in Killaclohane and how that fits in with it being a very early architectural, I suppose, treatment of the dead in Killaclohane. The evidence of multiple individuals, when you think back to the 121 grams of bone, you get some idea of how underrepresented the remains are on the site. There's a huge amount of bone that's missing, and we don't know where it is. And the other thing to take into account is that this tomb, clearly, it is not for the burial of everybody in a community. It's a very, very limited, select number of individuals that are being, their remains are being deposited in here. So in conclusion, there's been interference with the human remains because there's been a lot of activity in the site over the years. The osteological evidence is telling us there's a single individual, but other evidence is telling us that there's multiple individuals, and we know there's at least one female adult there as well. We have indication of cremation of fleshed and defleshed remains, so multiple things going on. There's an underrepresentation of bones and selective deposition, and again, ask yourself, what are they doing with all the missing bone? Where is that going? And then the retention of fragments from probably older cremations or other cremations, and the continuation of some type of cult of the dead, at least, possibly, or at least recognition of ancestry. So I will leave it there for now.